welcome to the show. If you're wondering what happened to the set behind me, it's because I'm working from home, and so as usual, I will be giving you latest news updates from my hall to your phones. Let's get into the episode now. So, this episode is going to concentrate on the cost of corona. Our leaders are repeatedly promising that the corona care for every single person in this country is very good and that corona tests and corona treatments are same for everyone, but that is not the ground reality. Often we see news about how people had to spend lakhs just for a few days of COVID treatment, and how treatment is different for people with money and people who cannot afford. Corona care in India is of wide ranges, from crowded wards at government hospitals to spacious suites at private hospitals, and only the super wealthy can afford that. As per India's healthcare system, everyone should be able to receive either free or highly subsidized care at government hospitals depending on their income. But the healthcare system has been seriously underfunded, and so government hospitals are overburdened and patients often wait for days even for basic treatment. World Health Organization's data says that in the year 2016, India spent $63 per person on healthcare for all of its 1.3 billion population, and when we compare it with China, China has spent about $398 for each of its 1.4 billion people in the year 2016. India has actually managed to reduce its poverty by half, but still there are some 170 million people who are still under the poverty line. That is, they earn less than 100 rupees a day. There is inequalities in everything from employment rights to healthcare. India's healthcare system is facing its biggest challenge now. People are waiting for hours or even days to get tested for COVID. Those who can afford are bribing the guards to get ahead, and those who cannot have to endure what they are going through for a longer time. This is happening in government hospitals. Private hospitals have higher standards of care, but most people cannot afford it. The daily rates for coronavirus treatment in India's biggest private hospital chains range from about 25,000 rupees for a bed in the general ward to 72,000 rupees for a bed in the ICU with a ventilator. The care is good, but even someone who earns 50,000 rupees per month cannot afford 72,000 rupees per day for critical treatment. The Delhi state government ordered hotels to be converted into rooms for isolation. Room prices includes daily medical care, and it costs about 10,000 rupees a night. The plight in government hospitals is not only reserved to COVID patients, but people with other health complications are also not able to go to hospitals because of two main reasons. One, most hospitals are not seeing outpatients for months now, and two, people themselves are hesitating to go to hospitals fearing the infection. So lockdown primarily protected the rich, but it did not protect the poor. The rich could afford to stay at home and the poor could not. The pandemic has hit India's poor the hardest, from the disease itself to the economic and social impact of lockdown. So they had to bear the disease. This is just a grossly unfair situation. Actually, nothing could be done now about this. It is a problem with no immediate solution. So let us know in the comments what do you think about this pandemic, especially in the financial front, and also stay connected with us for more such updates.